So camouflage has limits, and limits is dental compensation. Let's discuss compensation. Now, that's the normal skeletal problem without compensation. So we have large overjet. We have many patients, just he start to become older, and at the same time, he still has large overjet. It means that is class 2 skeletal without dental compensation. But in sometimes, if the upper lip is a little bit stronger than the tongue, the upper lip start to push the upper incisors back. So instead of having large overjet, you will have normal overjet with retroclined upper incisors. That's called compensation from the upper, or called class 2 with compensation from the upper teeth. That's why in some patients you have a skeletal problem with normal overjet. You ask yourself how he has a skeletal class 2 and the overjet is normal because of the compensation. Other cases, compensation happen from the lower. The tongue pushed the lower incisors forward, so the overjet became normal, but the profile is not normal. And for the third or the fourth option, we have here compensation from the upper and from the lower. The upper start to retrocline and the lower start to procline, so the overjet is normal. At the same time, the patient has a skeletal problem. So that's three scenarios of compensation, and that's skeletal problem without compensation. So you have one of them is retroclined upper or proclined lower or both. So the issue is the patient came to you with compensation and asked you, I need to correct the profile. I have protrusion. What you will do? It's indicated for orthognathic surgery. And to prepare the case for orthognathic surgery, the surgeon will ask you, please do decompensation. What is decompensation is? If the upper are retroclined, so you should procline. And if the lower is proclined, you should retrocline. It's called decompensation. And you can do both if the decompensation happens from the upper and from the lower. Because the surgeon needs large overjet so he can move the bone. He can't do the surgery like that. If he starts to move the mandible forward, he will end the case with anterior crossbite. Okay? If he starts to move the maxilla backward, also the same, crossbite will happen. So the surgeon needs overjet. And he will ask you, please achieve me 4 millimeter. Please achieve me 6 millimeter overjet so I can do the surgery. So you will decompensate the case and then send the case back. In most of cases, we need like 6 months preparation for the surgery. And within braces in place, the surgeon will do the surgery and then send the patient back just for occlusal settling by elastics. So we didn't remove the braces before the surgery. So now, again, if you have a skeletal problem and the growth stopped, so the only option is orthognathic surgery because you have a compensated incisor. So that's the issue. Skeletal growth stopped and you have also compensation in the incisor. The only option is orthognathic surgery or leave the patient without any intervention. So here we have a skeletal problem. So I will prepare the case for orthognathic surgery just to level, align, procline the upper, retrocline the lower, it depends on the case. And then the surgeon will check if the problem is from the lower. He will make BSSO and then protrude the bone and the teeth together. He will fix that with plates and send the patient back to you just to put elastics to settle the occlusion after the surgery. So it depends on the profile. Here, we can't extract upper fours to correct the profile. Okay, the patient complains profile. It's not about the overjet because the main complaint that happened here, in some time the patient said to the doctor, the surgery is expensive and it's a massive procedure. Can you go for any other option? And some dentists start to, yes, we can extract upper fours and retract upper incisors. It's completely wrong. It's fatal. Okay? It's only indicated for orthognathic surgery. And you can see here in some of the cases, the doctor here start to extract upper fours. It was a skeletal case. And then after extraction, he did correction of the overjet. And the patient came to my practice, okay, with normal overjet. And he asked me, Dr. Amr, please, I still have protrusion. Because the patient knows that the protrusion is from profile. And now what I can do to treat the problem here? Botox may be as a temporary option just to protrude the chin. But if the patient refuses the Botox and I need to prepare the case for the surgery, I need to open space. Instead of extraction that the doctors made here, I need to make push coil just to protrude the upper and then put 2 implants and then go and do the surgery for the maxilla or for the mandible. Okay? So it's more complicated. You need orthodontist, implantologist, and orthognathic surgery. So the doctor here worsens the case. And in the time of visiting the doctor, he starts to say for the patient, now you are normal, you achieved the normal overjet. It's not about the overjet, it's about the profile. What's the benefits of normal overjet with this bad profile? Okay, so please don't do that. It's not about the overjet, it's about the profile. It's called like face-driven orthodontics. The face that will move you to select the treatment option for the patient, not the overjet. And for